This is TTT Live. I am DK Rosstar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Suite 100.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, everyone. Today is Wednesday, the 20th of January, and thank you for joining us for the Ministry of Health's virtual media conference, which will provide an update on the COVID-19 response. Today, I am pleased to welcome back to the panel Dr. Roshan Parashram, Chief Medical Officer, Dr. Erica Wheeler, PAHO WO Representative for Trinidad and Tobago and the Caribbean Dutch entities, Dr. Avery Hines, Technical Director of the Epidemiology Division. I am Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. And we jump right into this morning's proceedings. I invite Dr. Parashram to present the clinical update. He will also touch on COVID-19 misinformation, which has been a challenge as we have gone through the process of the national COVID-19 response.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to Dr. Wheeler and Dr. Hines, members of the media, members of the viewing and listening public. So I'll go straight into the clinical update just to begin. So total number of tests submitted at the public and private sectors, just under 80,000 now, 79,485. Over the last 24 hours, we would have reported 16 positive cases. Total positive cases as of the 12th of March, 7,415. Total recovered patients, 6,945. Total active cases thus far, 338. And number of deaths now stand at 132. Total persons in hospital are 42. And those are split between the Couva Hospital and Multi-Training Facility, where we have 23 persons, 2 of which are in ICU. At the Cora Hospital, there are 12 persons, and at the Scarborough Regional Hospital at the Fort, there are 6 individuals. With regards to step-down facilities, there are 5 persons in our step-down at this time, 2 of those in Claxton Bay, and 3 of them in Tobago. With regards to our quarantine sites, we have a total of 312 persons as of this morning. They spread between many facilities. So at the Chancellor Hotel, there are 19 individuals. At the Cascadia Hotel, 7. Homer Football, 16. Regent Star, 22. At UE Canada Hall, 68. UE Freedom Hall, 84. Cara Suites, 10. The Cape Park Hotel, 86, giving us again a total of 312. In terms of home isolation, we have 275 persons in home isolation at this time. So if we can go into just a couple slides I have, as Ms. Alcantara would have indicated, about how to spot misinformation, disinformation related to COVID-19. So if we could have the slides up. No. Okay, so as we go through, you'll see the first slide coming up hopefully sometime soon. Various sources of information, maybe hearsay, everyday conversations. Next slide. So hearsay, everyday conversation, social media, WhatsApp, websites, newspaper reports, radio, television, and media conferences. So when we look at the individual, how to spot the information, the disinformation, we look at various ways we can do that, and one of them would be assessing the source. So where did the information come from? Of course, we look at reputable sites. For example, we have Dr. Wheeler here from PAHO WHO being a reputable source that we can, we know when they put information onto their sites that it has been validated by their technical groups, and it is a source that we have come to over the years to be used to using as best practice. Read beyond the headlines. A lot of times we have the headlines coming up, and when you read into the depth of the story, it tells a different tale. So let us not look at the headlines alone and jump to any conclusions. We look at the entire story and then we refer back to the headlines if needed. Identify the author. Is the author a subject expert in this particular area? What are their credentials, for example? What is the background for doing this type of work or this type of presentation. We can also look at the date that the information, a lot of times we have information being presented as if it were brand new and it would have been 2 or 3 years old. Sometimes that is done and it catches the attention of everyone, and this is maybe an incident that occurred years or months before and is just being reproduced for whatever reason. So look at the date, examine the evidence, check to see if the data is true. So what you can do is look at other sources of data. You can do searches on the internet to validate the data that is there, to see exactly before you again jump to any conclusions, and check your biases. Am I reading this with an open mind? So we always try to view any data presented or any information presented with some level of objectivity so that we can actually read the entirety of the article, look at the headlines, look at the data that is presented, and let us try to be as objective as possible and not view this with a tainted glass. So, Ms. Alcantara, that's my clinical update for this morning.
Thank you very much, CMO. And just a reminder that you can use Ministry of Health sites, PAHO sites, CAFA, and those are some of the entities that are working very hard to provide you with accurate information. And so you can depend on the information that you receive from their websites, social media. We all work collaboratively, and each of these organizations are staffed with subject matter experts. And we go now to Dr. Wheeler from one of our very treasured partners from PAHO, WHO office here in Trinidad and Tobago. And she will provide an update on the COVAX facility and on COVID-19 vaccines.
Thank you, Ms. Alcantara. Good morning to Dr. Parasram, CMO, and to Dr. Hines. And thank you for giving me this opportunity again to update you on the COVAX facility. But I want to begin by first saying a little bit about what's been happening with the preparation of Trinidad and Tobago to receive the vaccines. So government is proceeding with the plans to receive vaccines in Trinidad and Tobago as part of the COVAX facility. They have already developed their national vaccine deployment plan. Steps are being put in place to actually procure storage facilities for the arrival of the Pfizer vaccine, which, as you may have heard and you know by now, would be the first vaccine as part of the COVAX facility because it was approved at the end of December last year. There was a letter sent out to all the countries that are participating in the COVAX facility saying at the end of this month that we will be receiving a schedule for the rollout of vaccines. So things are being put in place at a rapid pace. So we know that the country is used to performing immunization drives, but we also know that there's some additional considerations that have to be put in place. We know that, for example, the cold storage facilities at minus 70 or minus 80 requires new equipment, so that is in fact also being procured. I will also be even making a trip with the team on Friday to look at those facilities. So things are going on apace in Trinidad and Tobago in preparation for the arrival of the vaccines via the COVAX facility. The global partners behind the scenes, we know that WHO is working with the Gavi Alliance, which is the global alliance for vaccines, and they're working closely with another organization called CEPI, which is dealing with the manufacturers. But these three global organizations that form part of COVAX, they're the ones, as was said many times by the minister and by myself, that are preparing to roll out the vaccine. So the idea is for the first wave of vaccines that it will be addressing the health workers of each country. So we're talking about equitable distribution. This was one of the aims of the COVAX facility. And after health workers receive it, then it will be rolled out to other categories of persons, such as the elderly and those with underlying health conditions, such as persons suffering from non-communicable diseases, diabetes, hypertension, and so on. So this would happen up to a total of 20% through the COVAX facility for the first phase, which is meant to end the acute phase of the pandemic. The COVAX facility said that they would procure 2 billion vaccines that are to be distributed by the end of 2021. They are on track. In fact, 3 billion doses have been secured already, but the 2 billion doses are, as I said, to be for countries in the COVAX facility until the end of 2021. PAHO has also been working very closely with the ministry in other areas of preparation. For example, the country has already received syringes because each vaccine has a particular gauge for the syringe. That's already arrived. The swabs, all of the materials that are required are being put in place by Trinidad and Tobago. So the effort to prepare the country is continuing as we speak. So again, just to reassure everyone that the reason why the Pfizer vaccine was the first one was because the way the COVAX facility works is that vaccine manufacturers approach WHO with something called an expression of interest, and then as the information comes in, WHO reviews it, assesses it, and on the basis of what they call stringent regulatory authorities in other countries, you have the USA, Canada, and also Europe, but particularly in Europe, WHO looks at the information they receive, and on the basis of all of these things put together, a vaccine is then approved. So it's not that WHO is slow, it is that we have to be thorough because we serve the whole world. So this is where we are now. So the good news is that preparations are being done, and that we are hoping that, not hoping, but the plan is when we hear at the end of the month from the COVAX facility, we anticipate that vaccines should be available in the Caribbean by March at the latest, February or March, but we have to wait to hear the actual schedule. Thank you.
Thank you very much, Dr. Wheeler, for that important update. And so we all understand now that things are moving forward with plans for COVID-19 vaccination. And we go now to Dr. Hines, who will present the epidemiological update.
Thank you, Ms. Alcantara. Good morning to the CMO, to Dr. Wheeler, to the members of the media, members of the viewing and listening public. I'm going to begin with the slides for the epidemiologic update, and we're going to begin by looking a little at the global picture. So next slide, please. As at yesterday evening, we would have seen that there were over 94 million confirmed cases of COVID-19 globally, including over 2 million deaths that would have been reported to the WHO as at January 19th, 2021, for a global case fatality rate of about 2.16%, or 2 in every 100 persons. Next slide, please. Looking at that global overall trend, we see that the heights of those bars showing daily numbers of cases, those bars have continued to move upwards as we move from left to right, showing that there are basically increasing numbers of cases day on day. I want to go back one slide. Well, the slides don't seem to be in order, but there is another slide in between that shows the general contribution of each region, but proceed forward. Yes, this slide. This slide shows the general contributions of the main regions contributing to that large global spread, and what we're seeing is the blue for the region of the Americas and the orange for the European region being the predominant contributors to the global numbers at this point in time, indicating that there's a lot of virus activity, a lot of transmission, lots of new cases per day being reported from those parts of the world. When we separate those out by regions and look at them day by day, next slide, we see that the blue and the orange, again, the American and the European regions, are the ones that continue to have high numbers of cases at this point in time. And even though we are seeing, hopefully, the beginning of some sort of plateau leveling off in that orange section, the numbers that are being reported there are indicative of high levels of activity. And just to point out that both the American and the European regions are the regions from which the vast majority of all repatriated cases come, hence the need for continued caution. Next slide, please. Locally, there have been 7,415 confirmed cases as at the end of yesterday, including 132 deaths, our local case fatality rate being 1.78%. Next. Looking at what we call the epidemiologic curve, we'd see that we've changed the format a bit. Everything that was 2020 is now in gray, but we're keeping it on screen for context so that we see the green section at the end, which represents the new cases in January, and the black dotted line, which represents the rolling average. And although it's a little difficult to see here, the point I'd like to make right now is that that rolling average is creeping slightly upwards. The new cases per day are inching upwards. And if you look at the number of new cases per week, we would see that in the last 3 completed calendar or epidemiologic weeks, we would have had a steady increase from 58 cases in the last week of 2020 to 82 cases in the first week of 2021 and 126 cases in this last completed week, last week. At present, we are hoping that we don't exceed that with the completed number of cases at the end of this week, but the upward trend is a cause for concern. And it is a cause for us to remind the population that we do need to avoid the tendency to gather, as we may want to do at this point in time, in line with our desires for our celebratory season. And that we do need to ensure that we adhere to all of the public health guidelines regarding physical distancing, regarding mask wearing, the hand sanitization, and most importantly, avoidance of workplaces and other communal settings if you feel unwell. Next slide, please. Looking at the demographics, we will see that they are basically as they have been throughout the entire epidemic, with the majority of individuals being in the 25 to 49 age group, and a slight preponderance of males over females, about 53% men compared to women. So almost 50-50, but slightly more men. Whereas, next slide, the fatalities have maintained a slightly different pattern, and that pattern shows a much greater preponderance of males among the deaths, with 73.5% of the deaths to date having been among men, and the vast majority, more than 2/3, having been in the over 60 age group. And what we are seeing recently is that we are seeing a number of deaths occurring over the last few days, again in the elderly population, and perhaps suggestive of transmission from younger family members to older ones, with the younger family members either being asymptomatic or mildly symptomatic and well, but the older ones not having such a good outcome. So we do again want to ask the population to bear this in mind so that we don't expose our older population, the older persons within our families, because they are at a much greater risk of having an adverse outcome if they get infected. And the last slide, we're looking here at the distribution of cases by community. And we're seeing the lighter colors, meaning smaller numbers of cases. The legend tells you exactly how many in each community. And then the darker colors going down to red, showing the higher number of cases by community. And we do see that the communities that have the highest cases are communities in County Caroni and in St. George East. And while the numbers here pinpoint those counties, we do also want to point out that the green outlines around many communities indicate that there's still activity throughout the country, and that we still need to be careful across the board throughout the entire population in adhering to the public health regulations. So that brings me to the end of the brief epidemiologic update. I'll turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. And before we go into the question and answer segment for media, we just want to address some of the public questions that have come into us. First question, what are the side effects of the COVID-19 vaccine? Just repeating, what are the side effects of the COVID-19 vaccine? And we go to CMO for a response, I believe.
Yes, so if we focus on the Pfizer vaccine, which is has been one of the vaccines that have been rolled out across the UK and the US. Most common side effects will be pain at the injection site, possibly a feeling of lethargy for a day or two, which is in keeping with other types of vaccines that would have been given for many years. So that's a commonality that we see from the COVID vaccine and even for other vaccines that have been given to the population over many years. For in particular reference to this particular vaccine, we have seen a slight increase in, and there have been advisory from the SAGE group, as I said last week, saying that these persons with severe allergies should not take this vaccine in the first instance, and therefore it is a contraindication to taking this vaccine. So that is something that we have been seeing from time to time, and WHO is now advising against persons with severe allergies to anything else or components of the vaccine that are known don't have this vaccine. So those are the major side effects that we are seeing.
Thank you, CMO. And second question, is it safe for me to donate blood during the pandemic? As we know, blood and blood products are very important for health delivery.
Yeah, so we want to underscore the importance of continuing to donate blood, and we're trying to get persons to donate blood voluntarily, get that number up in the country. It is important, especially during any pandemic, that we have enough supplies of blood. To that end, all our donation sites remain open, and continue. The hours can be had on the Ministry of Health's website, and we are planning in the coming weeks additional blood drives using our mobile unit, which was launched a few years ago. Candice? Yeah.
Thank you, CMO. And the final question, is Trinidad and Tobago seeking to access the vaccine, the COVID-19 vaccine, through the COVAX facility only?
Right. So the Honourable Minister would have been noted as saying on numerous occasions that we were both exploring the procurement of vaccines through the COVAX facility as well as through bilateral talks with different agencies that actually manufacture the vaccines. Those talks have actually begun by way of technical meetings as early as October 1st of 2020, having meetings with different distributors, different manufacturers from across the world, and continuing up to present. So we are exploring both within the COVAX facility and outside of the COVAX facility.
Thank you very much, CMO. And we go now into the question and answer segment for our media representatives. I know you have your questions ready. Please indicate your name and the media house that you represent before posing your two brief questions. Please pose them both together. And of course, if we have more time, we will accept additional question or so. And so we're going straight into the questions from CNC3.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. Okay, CMO, so my two questions are for you. I like that you spoke about procurement of vaccines just now there, because my question is, yes, we've been having these technical meetings, and we are trying to go outside of the COVAX facility to get possibly get a vaccine. But I want an update as to how fruitful do you think we would be in getting that vaccine, and how has things been going so far, considering that a lot of countries are raising concerns globally about the equitable access to the vaccine. And now my second question, CMO, is should we be able to procure a vaccine or outside of the COVAX facility, or vaccines become more widely available? Is there a policy position as yet on if private entities locally can import these vaccines and distribute it?
Okay, right. So the talks are going on since I said October, and we were looking at two things. We're looking at the technical aspects of the vaccines. So the majority of them would have been in a phase 3 sort of situation way back in October. We have seen WHO come ahead and look and give approval for Pfizer to go ahead in terms of emergency authorization as one of the first vaccines in the world to have that. Now, seeing that that is the case, it is of course easier for any regulatory agency, especially in a small country like Trinidad, to go ahead and approve based on WHO's pre-approval. So we are looking, of course, to Pfizer as an example, as well as some other countries, AstraZeneca, Oxford vaccine, and we have been talking early on with regards to the Sinopharm vaccine out of China. We again have to look at the efficacy of those vaccines. For example, the Chinese vaccine, there was a recent article out of the Brazil study that put it at about 50.4% effective. So when we look at procurement, we have to make sure we are going to procure something that is safe and effective, and serves the purpose to actually, one, protect the vulnerable, and two, go towards herd immunity. So the talks have been going well, I think, overall. Those companies would have would be procuring both, or have a manufactured stream that is geared towards COVAX and out of COVAX. So I suppose as it continues, we can update the population, but I think I have to be optimistic at this point that we will be able to get from both sources. In regards to your second question, you had asked about the policy of the government's policy as it relates to private utilization or private procurement. So most of those companies do have agents in Trinidad and Tobago that can procure vaccines. There's nothing stopping a company from bringing a vaccine into a country once it's registered with the Food and Drug Division. So if it is registered, then of course it can be imported, but we are looking at least in the first phase, because it's a vaccine that is under emergency use authorization, that we use it in the public sector in the first instance, and then we see, of course, how it is going by way of utilization, the adverse reaction profile, and then, of course, later on down the line, we can look at public-private partnerships as the need be.
Thank you very much, CMO. And we go now to AZP News for questions.
Hi, good morning. Prior Bihari, AZP News. My question is for the CMO. CMO, last you spoke about people who have severe allergies shouldn't get the Pfizer vaccine at least. How is that going to be determined when someone goes for a vaccine? Does that have to be, should that be done beforehand by the patient? Because, for example, when there's a large concentration of Sahara dust, for example, my allergies, they act up, and I'm sure that happens to a lot of people. Should we therefore not get that vaccine? How is that determined in terms of the allergies? And my second question is for Dr. Wheeler. Dr. Wheeler, when a country goes into a bilateral agreement and with the manufacturer of the vaccine, does that country also has to get the approval of PAHO and who to bring that vaccine into their country? Thank you.
Okay, so thanks, Prior. That's a very good question. So who determines? Normally, your physician will determine if you can and cannot take a vaccine. So, for example, you raised the point about respiratory allergies. Having those kinds of symptoms are not the allergies that we really speak about, but they do put you in, having sinusitis, as you described it, does actually put you in a higher risk for other types of allergies. So when we speak about the vaccine in particular, we're talking about people who would have had allergic reactions to the point that you have severe manifestations. For example, persons that have extreme reactions to seafood, for instance. You have rashes all over your body, you have difficulty breathing, those kinds of scenarios occurring. So people who are prone to severe reactions to even food products, we would not recommend it at this time, and that is based on WHO's advice as of now. So the person that has to determine it really is your physician. So your physician, for not only the COVID vaccine, but for the vaccines before COVID, would have taken a proper history to determine if you have allergies that are of concern. For certain vaccines beyond COVID, there are allergies to eggs, for instance. Some vaccines are produced using the chicken embryo, and those individuals would not be able to take that vaccine, for example. So a thorough history has to be taken by your healthcare provider, usually a physician, prior to getting the vaccine. By way of COVID, what we are trying to do is we're trying to create a database of all the people that would be given the vaccine in the first phase. So we're looking at persons with NCDs, we're looking at healthcare workers, we're looking at anyone on our list that will be, so we're creating that list, and we will actually be able to reach out to them prior and do possibly a history before they actually come in, and we will let them know based on what they decide if they are a person that can actually have the vaccine or not. So we're trying to be a little preemptive for the COVID vaccine. So hope that answers your question, Priya. Dr. Wheeler?
Yeah. So thank you. Thank you, Priya, for that question. So when a country decides to make a bilateral arrangement, it is not necessary that they're approved by WHO. For example, we know that Bolivia has bought vaccines from Russia, but of course it is advisable from the perspective of safety, quality, and efficacy that a country knows those parameters before buying a vaccine. Now, I mentioned something called stringent regulatory authorities. Some countries also look at the regulatory authorities in the UK, Canada, the USA, and Europe before making a decision about purchasing a vaccine. So to make it clear, a bilateral agreement outside of COVAX, WHO does not have responsibility for instructing the country what to do, but the country can certainly ask for advice from WHO, and also they do look at other stringent regulatory authorities that are on a list of approved regulatory bodies by WHO, and they can make a decision based on that to buy vaccines. If it is in COVAX, then automatically, or the stringent regulatory authorities plus WHO give that emergency use listing. And that is not uncommon to have an emergency use listing, at least for the first year while the vaccine is new. I hope that answers your question. Thank you.
Thank you very much, Dr. Wheeler. And we go to Wired 868, please.
Hi, good morning. My first question is, since we don't yet know how long the immunity given by these vaccines would last, Moderna, I think, says they can say theirs lasts about a year. What happens if the first group, that 20% or 33% of people who we immunize, what happens if their immunity runs out before the majority of the rest of the population is immunized? That's my first question. My second question is, within the elderly group, would there be priority even within that priority group? So would possibly men be given higher priority, 65 and over given high, would there be any different type of priority within that elderly population?
Okay. All right. So again, how long will the immunity last is a question that I think all over the world we don't know, and simply because the virus has only been with us a certain length of time, and of course vaccination has only just begun. So we have to give it some time before we can tell how long immunity is going to last. With regards to your question, what we would do is, of course, hopefully we will have the population vaccinated before we have to go back to that first group to be revaccinated by way of waning immunity. So we are hoping to get through the at least the entire population that is earmarked to be vaccinated before we have to go back to that first 20%. But of course, as the months progress and we see what the immunity is for various vaccines, how long they will last, only then we can make that determination. So it's difficult to say at this point. By way of policy, the minister had reminded me that he had said, I think in December, if you have a vaccine that requires 2 doses, that we as Trinidad, for example, if we get 100,000 doses of a vaccine, we will give that to 50,000 persons, making sure that there's enough for them to have both dose 1 and dose 2, and not give 100,000 persons 1 dose and wait for an additional supply. So by way of policy, that's where we stand. In terms of the age groups, yes, 60, what we're using in Trinidad is 60 years and over as a cutoff for age. But there is usually overlap between persons who have, so you may be on 2 lists. You may be 60 years and over by virtue of your age alone, or you may be on that list by virtue of your status in terms of NCDs. So you might be on 2 lists, but there's no priority for that group over 60 in a real sense. But again, if you have NCDs plus over 60, you may be given, by virtue of being on 2 lists, you may be higher up in terms of priority, slightly higher up.
Thank you very much, CMO. And we go to TTT, please.
Good morning, Crystal Wilson, TTT Limited. I have 2 questions. My first has to do with churches. My understanding is that at some, not all of them, the choirs, there seems to be an absence of both social distancing and mask wearing. I think it's causing some concern to other members of the congregation. So I'm asking whether or not the Ministry of Health will be willing to take a closer look at this. And my second question has to do with the possibility of some children returning to school in February. Is there a consideration for children who are in fact high risk and also those who are also coming from high-risk homes, whether or not the Ministry of Health is looking at certain recommendations to protect that particular group of children. Thank you.
Okay, so let me take the first question, the second question, which is about kids. So we are actually, I don't want to preempt any discussion, but we're having a meeting with the ministry, that is Ministry of Health and Ministry of Education, called by the Honorable Minister on Thursday morning to discuss what is going to happen with the schools situation. I don't want to preempt that discussion in any way. But having said your specific question as it relates to high-risk groups, generally speaking, the guidelines are supposed to protect all our children similarly. And of course, someone that knows that their child is, in terms of, for example, the child has asthma or is in has a respiratory disease that precludes certain activities, then the guidelines speak to general protection of all our children to the same level. So it wouldn't be a specific sort of protection that is given to any subgroup of that. So we expect that the guidelines that we put in place will be enough to protect all individuals and even those who are vulnerable from getting COVID-19. So we have to be, again, having the meeting on Thursday morning to discuss the guidelines and the possibility of reopening. And then, of course, we can say something a little bit more in terms of education.
Thank you very much. And I think Dr. Hines is going to respond to the question on churches, the first question that was raised from TTT.
Okay, thank you for that question. It is an excellent one. We do, again, note that in some instances we are seeing deviations from the recommended practice, and we do want to strongly discourage those deviations. We do need to ensure that in whatever situation people are gathered, that all of the recommendations regarding the physical distancing, the mask wearing, the sanitization, the minimal or minimizing of occupancy, that all of those guidelines are followed strictly and throughout the duration of any planned gathering, because that is the only way that we will manage to minimize the risk associated with allowing individuals to gather under controlled circumstances while still trying to reduce transmission in a population that currently still has community spread. So in any event, in any instance where there are individuals gathered for church service or for any other indoor setting, and physical distancing is not being observed or masks are not being worn in any of those settings, you're increasing the risk of transmission. And especially in the church setting, where the church-going population tends to already come from the more senior end of the age spectrum, you're putting a more vulnerable group of individuals at higher risk by not adhering. So this is a good opportunity to encourage all to adhere to all of the guidelines. So thank you for the opportunity.
Okay, and we just wanted to add to Dr. Hines' answer by saying, of course, we will reach out to the police service as well as the IRO to ensure, as you know, the guidelines are on the website, Ministry of Health's website, so anyone can get access to it. But again, to reiterate the role of TTPS and IRO in assisting us in having that clarion call to all the places of worship so that they follow the guidelines stringently to avoid any risk.
Thank you very much, CMO, and the persons can go to www.health.gov.tt, and there are a range of guidelines up on the Ministry of Health's website. Of course, all other reliable sources have some sort of guideline to that effect. We go to IETV, please.
Hi, good morning. Bina Mahir from IETV News. I have two short questions. My first question is to Dr. Wheeler. A recent CNN article stated that the new COVID-19 variant might partially evade protection from the vaccine. It basically stated that you may become infected even though you are vaccinated with the COVID-19 vaccine. Do you have any words or advice for citizens who are doubtful or may panic over that news? And my second question would be for Dr. Hines. Dr. Hines, do you have any updates on potential post-holiday cases, as well as are there any particular reasons for County Carney accumulating perhaps one of the highest numbers of cases at this time? Thank you.
So thank you very much for the question. Actually, just this morning, I was reading that the Pfizer vaccine manufacturers have been adjusting their vaccine, and it has been seen so far in the trials to be effective against the new variant in the UK and also in South Africa. So you have to remember that the vaccine manufacturers are continuing, even as we speak, to do trials to ensure that their vaccine, it's in their interest, of course, is effective against the new variant. So there are trials going on a limited number of individuals. There is another issue in there, which is about the efficacy of the vaccine, meaning if you take the vaccine, can you still transmit it, which is a sort of subtle in-between question there. Now, the evidence we have so far is that, of course, the Pfizer vaccine is 95+% effective, but we believe so far from the data that it is still possible to transmit the virus, even though you yourself don't have the disease. So what is critically important until we reach the stage of herd immunity in any population is to continue to observe all public health measures. Meaning, again, you have to continue to wear your mask, keep your physical distance, wash your hands, sneeze into your elbow, all of those things. So we must not become complacent and think because we have a vaccine and the first 3% in the first instance are vaccinated, or when we reach 20% of the population. So there are different responses to different parts of that question, but essentially, the manufacturers are working on ensuring that they can address the variant because it is in their interest. And so far, Pfizer has said yes, their early trials have shown efficacy for when they've adjusted the vaccine. B, you may still be able to transmit even though you don't develop COVID-19 when you get the vaccine. And therefore, C, you need to continue to observe all the public health measures. Thank you.
Thank you very much, Dr. Wheeler. And we go now to a follow-up question from CNC3, please.
Hi, morning again, everyone. Okay, so Dr. Parashram, I'm not sure if you'll be in a position to give me a comment on this, but for the month of January and for the year so far, we would have seen the public health regulations being extended twice. Now, I know the first time there was supposed to be a press conference, but unfortunately, due to the Prime Minister's health, we did not see one. But then I believe it was sometime earlier this week, we got another extension on the duration of it. But we didn't get any explanation as to why. Was this a case of the ministry or the government saying, okay, let's just wait out and see what January brings before we make any adjustments to it or anything like that?
No, I don't think I could comment much on it. Normally, the meetings are not prompted by the Ministry of Health. So, having said that, the maintenance of the status quo is based on what has happened over the Christmas season and what we saw by way of public health measures not being adhered to. The numbers, as Dr. Hines has said, continues to rise. So, expectantly, we won't be able to relax anything at this point, at least. But I can't comment on that particular question.
Thank you, CMO. And I must apologize. I forgot about the second question from IETV. And so we're going to Dr. Hines to address the question that came up from IETV. Apologies.
It was the update that spoke about the follow-up on the data of any cases that may be arising out of gathering activities that may have taken place throughout that holiday season. I did point out that we have seen a steady week-on-week increase from the last week of 2020 into the first 2 weeks of 2021. 58 cases in the last week of 2020, 82 in the first week of 2021, 126 in the next week of 2021. And we do have the general feeling that may be as a result of increased gathering and decreased adherence to those measures that we've been advising. So that was the update with respect to the gatherings and the holiday season. I do want to point out that although the map may look like County Caroni had the most cases, at this point, looking back at the last 2 weeks of epidemiologic data, it's actually County St. George East that has had the largest groupings of cases in communities, and that is, again, partly as a result of the density of the population, the number of people that actually live in the areas under consideration. So you'll find that where there are more people, there's more of a chance of virus spreading. But not to take away from the fact that the risk applies across the country. So whether it's County Caroni, whether it's County St. George East, or whether we're looking at the other areas that have not been mentioned, there is the continued need for vigilance and for adherence to the public health guidelines. I'd also like to just tack on a bit to what Dr. Wheeler said, because she did say something that I know some people may have either heard wrongly or not understood properly, where she says after being vaccinated, you can still transmit the virus without having the disease. And it's just really to clarify that by disease we mean you don't become ill. So you may be infected with the virus, your immune system is fighting the virus well, and you aren't having symptoms, and that is because the vaccine has primed your immune system so that you can fight off the symptoms, fight off the infection to the extent that you don't feel unwell, but it is still possible to shed virus even after being infected, after having been vaccinated. So it's not that the vaccine then allows you to shed virus, and it's not that you shed virus without being infected. Disease really specifically means being unwell as a result of having been infected, and even if you're not unwell, you can still possibly shed virus even after vaccination. So just wanting to clarify for those who were curious about that particular point.
Thank you, Dr. Hines. And we have an additional question from AZP News at this time.
Hi, good morning again. Before I ask my question, can I ask Candice that anytime there are slides that are presented, can the media get your copies of them via soft copy? And my follow-up question is for the CMO. CMO, since children 16 and under would not get a vaccine, how does that factor in terms of the opening of schools? Thank you.
Okay, so I wouldn't say that they would not get the vaccine. Most vaccine trials are not done on children, right? So the initial emergency use authorization is not to have children under 16 for that particular vaccine vaccinated. So I don't want to jump to the assumption that nowhere down the line children will be allowed to be vaccinated. They may be, but much later on. By way of population achieving herd immunity, what herd immunity really means is that you protect the ones that are vulnerable and cannot have the vaccines. In this case, at least on the outset, we're talking about all children, right? And children, we have seen children in Trinidad and Tobago have MIS-C presentations, upward of 20 persons presenting to hospital. So children are at risk of severe disease. It looked like about 3% of our children that were affected under 19 presented with some sort of severe manifestation, which is a large amount of children presenting. So we have to protect the children at all costs. One way to do it, of course, is to develop herd immunity. So your parents are vaccinated. If you have siblings over 19, they are vaccinated. So chances are there's some degree of isolation even in the home. And of course, if the rest of the population is vaccinated and the numbers of cases in the country go down, then you have very minimal viral load in the country. It decreases the likelihood of somebody getting infected in a school environment. So that's the best way to prevent infection, is to actually have a country that has very, very low viral load in the general population by way, and go backwards from community spread to maybe sporadic, so that we can have a smaller likelihood of having children being infected when they go to school. Also, the guidelines that we have in place, the hours that you spend in school, wearing of masks and all of that have to play a significant role to protect the children across the board.
Thank you very much, CMO. I think we have a follow-up now from Wired868, please.
Hi, good morning. Just to connect about herd immunity. I'm wondering, with herd immunity, some people have asked that if the vaccine eradicates the virus. So with herd immunity, will the virus actually be something that we're looking for or no?
Unfortunately, I think CMO, did you get enough of
Yeah,
the question?
so I think so.
Oh, sorry, Wired 868 is still on. Let's see if we can get the full question.
Sure.
Yes? Okay.
I don't know what you missed, but I'm just asking whether or not the virus eradicates, the vaccine eradicates the virus, and whether or not it will just still be around, even with vaccination.
Right. So it really depends. I mean, that question, what we try to achieve in the first phase, as Dr. Wheeler has indicated, is to get the acute phase stopped, meaning that we have enough people, we protect the vulnerable. What we're trying to do in Trinidad in the first phase is protect the vulnerable persons. So the groups that I have listed is really the vulnerable individuals, those that would have severe disease if they get infected in the first instance, and of course healthcare workers and other frontline workers who have a greater risk of being infected by virtue of their work. So generally speaking, that's the first phase. The second phase goes towards herd immunity. And herd immunity is really trying to get enough people immune to the disease in the population so that we decrease the risk of transmission from one individual to the next. It does not in all cases mean that the virus disappears from the population, but it means that the level of spread is much lower and decreases significantly in the population to a point that it may actually not disappear, but it may be at such a low level that it's very hard to go from one person to the next. So that's the phase 2 of our vaccination strategy, will be to go towards herd immunity. But it doesn't always mean that the virus is eliminated from the population. And just on the previous point, whether persons who are vaccinated in the early days, the research is not back as yet as to whether those persons can still harbor the virus in your nasopharynx and be able to spread it although you are vaccinated. So having a vaccine means that your immune system is built up. You have antibodies, so if the virus gets into your system, you can fight it at a personal level, but it doesn't mean that it stops it from getting into your nasopharynx so that you may be able to spread it. So again, vaccination and infection and infectivity of the population doesn't always go hand in hand, but it does protect persons from getting disease and decrease the risk of morbidity and mortality in the country that the vaccination occurs.
Thank you very much, CMO. Our final question from CNC3, please.
I'm getting 4 questions today, boy. Okay, so CMO, I have a question. It's a bit more on the ethical side of things that we're talking about vaccinating the elderly and that kind of thing. How is it that the ministry intends to decide who gets the vaccine? I mean, if you have an elderly person who's about 80 years old and with comorbidities and realistically has about, say, 2 years again to live, is this person going to be given preference over probably somebody who is, say, 65 with comorbidities but could have about a 10-year lifespan after that? How is the ministry approaching this situation?
Yeah, so you raise the ethical issue. We can't make that determination. So our strategy speaks to anyone who is over 60 being vaccinated. And the question that was previously asked, would anybody in that group be given priority over the other? And the answer is no. So when we select someone over 60, you select anyone over 60 we will vaccinate everyone in that group. Of course, if you can't have it based on a contraindication, that's a different matter, right? But we will vaccinate based on that strategy, and the strategy is supposed to be something that is equitable and something that is not giving one group of the population disproportionate access to a vaccine than another when we select our groups. But as I said, initially selecting those groups based on vulnerability, based on research worldwide, but we're not going to handpick persons out of any particular group.
Mr. Seymour, can I add to that?
Sure, yeah.
Yeah, I just want to add to that there is something called the WHO Scientific Advisory Group, and they have done extensive research. It's a standing group, and they have put out global guidelines for countries all over the world who are part of the COVAX facility on what are the priority groups too. So Trinidad and Tobago is also keeping in line with that global advice. And even for the Pfizer vaccine, they have put out specific recommendations about who the Pfizer vaccine should be used with. So, for example, the CMO already described, for children under 16, it is not yet recommended. So this is something that countries have a certain amount of flexibility in, for example, when they say the elderly, whether they start at 60 or 65 and so on. But there is also global guidance for countries based on sound scientific research and hundreds, if not thousands, of papers and reviews of clinical trials about who best these vaccines should be used with, even according to the vaccine. And we have to keep reminding people that vaccines have only just recently started being given to individuals. So there is much to learn, but we do have the global scientific advice about who are the priority groups and who, as the CMO said, are the most vulnerable groups. And on the basis of that, countries are also referring to that when they determine who should get the vaccines first. Thank you.
Thank you very much, Dr. Wheeler, CMO, and Dr. Hines. We have come to the end of this morning's media conference, and we were reminded today, even as we move towards vaccination, we were warned against becoming complacent. Everyone, please stay the course. As we close, we go to an educational video from the World Health Organization. Please be safe and wear your mask.
Hello and welcome to Science in 5. I'm Vismita Gupta-Smith. This is WHO's Conversations in Science. And today we're talking to Dr. Sylvie Brion. She's the director of the Department of Global Infectious Hazard Preparedness. Sylvie's team tracks several dangerous and infectious pathogens around the globe. Welcome, Sylvie.
Hello.
Sylvie, we are going to talk today about myths and science. Many of these myths and misinformation have been circulating along with the COVID-19 around the globe. And some of these questions that we're going to talk about today are actually sourced from Google's most searched questions. Also, some of the questions that we get on various social media channels. So let's get started first with the one about weather. So we hear again and again different versions of this myth that the weather affects the transmission of this virus, that if the weather changes from warm to cold or from cold to warm, that transmission would change. Is that a myth or a fact?
What we have seen so far is that some countries with hot climate have had outbreaks, but similarly countries with a cold climate also have outbreaks. So it seems that the weather doesn't affect significantly the COVID-19 transmission. However, what we know now, there is specific settings and circumstances that affect the disease transmission. And for instance, if you are a long time in a crowded, closed space with limited ventilation, there is more risk to have COVID-19 transmission. And this is sometimes what happens in winter. Because it's cold outside, people tend to stay inside in places that are poorly ventilated, closed, and sometimes crowded.
Let's say I am infected with COVID-19. If I get into a pool, can I transmit it to others? Can water transmit this virus?
So water cannot transmit COVID-19. Drinking water is not transmitting COVID-19. And if you swim in a swimming pool or in a pond, you cannot get COVID-19 through water. But what can happen if you go to a swimming pool which is crowded, and if you are close to other people, and if someone is infected, then you can be, of course, affected. So that's why even in swimming pool, it's important to maintain physical distancing.
Another one, this one is from Google's most searched questions. Can mosquitoes transmit COVID-19?
Mosquitoes cannot transmit COVID-19. Although we know that some viruses like Zika, chikungunya, yellow fever, or dengue can be transmitted through mosquitoes, but COVID-19 cannot be transmitted by mosquitoes.
Sylvie, there is so much misinformation out there, and a lot of information is pushed to each one of us. It's hard to distinguish the good from the bad. How can people know when information is to be trusted?
this is a phenomenon we see with each epidemic. There is an infodemic, which is the overabundance of information, good or bad, but that makes difficult for people to differentiate what is good information from what is bad information or useless information. And then people feel confused, and sometimes it increases their fear and anxiety of the disease. So it's very important during an epidemic to manage this infodemic, and everybody can contribute to this. First of all, people need to look at trusted sources of information. Sources of information like the WHO, for instance, or other technical agencies, because we spend a lot of time to verify information. And the second thing that is very important, in addition to go to trusted sources of information, is that everybody needs to be very careful when we spread information through social media or when we discuss with neighbors or friends. When you have an information that you are not very sure about, please verify it before spreading it. And like that, we will all be infodemic managers, and we will reduce the spread of misinformation and disinformation.
Thank you, Sylvie, for busting these popular myths for us. That wraps up Science in 5 today. Come back next time for another Science in 5, where a WHO expert will explain science. Until then, stay safe, stay healthy, and stick with science.
Where you hustling now up to? This is the beach. You're supposed to be relaxing.
Well, I'm going to get some bacon shark.
Oh, all right.
Yeah, my boy, yeah.
Just remember, it's still have COVID out there. Beach or no beach. Yeah. Hey, you wash your hands? Where's your mask? You know what? 10 things to remember when you're by the beach. If you're sick, stay home. Wear a mask. Oh, social distance.